to talk about insulin pump therapy and its role in improvement of glucose control during Ramadan fasting. Technology. We all know that it prevails in all fields in nowadays, whatever the age we are talking about. Diabetes is one of those fields that we use different types of technology, ranging from insulin pump and continuous glucose monitoring, and moreover, integrated system of both technologies. We are all acquainted with the different basal rate needed during daytime, nighttime of different levels of insulin and counter-regulatory hormones. This different type of basal insulin cannot be easily determined by using multiple daily injections, but it is easy to be done through insulin pump therapy and its flexibility. And earlier in 2013, we have seen publications coming about the efficacy as well as safety of insulin pump therapy during fasting in Ramadan. However, recent studies have found the effectiveness of the sensor-augmented insulin pump, as well as the integration of this pump into the accuracy and better glycemic control in adults. But this was moreover seen in children about the effectiveness of not only glycemic control, but improving quality of life in those patients. So, technology matters? This is a question. Yes, definitely it matters, because we are being asked frequently about how should we manage diabetes during fasting in Ramadan. And definitely we are all acquainted with the clear guidelines coming from Dar with different specific chapters. And the most important thing that we are localizing into and considering safety. As safety comes first, we should consider when to stop fasting. When the blood glucose goes low, with the blood glucose level less than 70 milligram per deciliter, or even high, more than 300 milligram per deciliter. But if we're looking at the insulin pump flexibility throughout the day, we can see that we can change the rate of basal insulin. So if this is before Ramadan with a good glycemic control, we can see the very well-known afternoon hypoglycemia in the few hours, 2 to 4 hours before breaking the fast. So we can simply readjust the basal insulin by decreasing it from 2 to 4 hours before breaking the fast, ranging from 15, 35 or up to 50% in some patients in order to avoid hypoglycemia. So this is a crucial point to do that. So how do you define success with diabetes and fasting? This is the most important point. You need to stop hypoglycemia. So let's make an alert about diabetes technology. Safety comes first using insulin pump. So if we're looking at the earlier versions of earlier pumps like the low suspend, you can see different publications coming from our region about the safety and effectiveness of the low glucose suspend during fasting in Ramadan. And you can see here the guidelines on how to adjust your insulin pump, whether basal or bolus, in order to have a better glycemic control. You can appreciate here seeing the red arrows that stopped the hypoglycemia using this feature. Almost 2 hours of insulin basal suspension to avoid that. So safety again comes first. What about the next version? So now we are not talking only about suspend on low, but we are talking about suspend even before low. So this is important because when you are having an automatic shot of insulin delivery, in case you're having severe hypoglycemia, and this is according to the predetermined glucose low level. Again, a poster, which is an abstract accepted in the International Society of Pediatric Diabetes about this feature of insulin pump, about predictive low glucose suspend, and how you can conduct fasting in a safe manner through this feature in insulin pump. Again, this is the blue line showing the predictive low glucose suspend, rendering the occurrence of hypoglycemia. But actually, it did not stop to this level. But the insulin pump got smarter and smarter. with the presence of different algorithms connected between the sensor as well as insulin pump. And here's come the hybrid closed loop, the newest version of insulin pump. So actually the presence of smart guard technology that would show us that we are seeing now not just preventing the highs, but also preventing the lows. And now you can have an automatic control of the basal insulin. So the bolus is delivered automatically up to every 5 minutes. And the algorithm is very important for assessment of the correction dose in a safe manner, taking in consideration the rate of change, the sensor glucose value, as well as the active insulin in the body. And you can see here hyperglycemia that has been corrected by the auto correction boluses with the hybrid closed loop. And again, an excellent time and range, even more than what is needed by the international guidelines, reaching up to 90%. Moving to another type of hybrid closed loop, which is the do-it-yourself artificial pancreas, and the effect of using those systems, a kind of hybrid closed loop. And one of the loopers is writing a case report about how he could manage the fasting and diabetes in a safe manner, as well as having a better quality of life with this system. We have talked a lot about the basal, but what about the meal, the bolus, which should be focused in again? We are all acquainted with the dietary advices and how we can use a specific balanced meal according to the daily caloric target. And you can see different meal planning according to the country in our region. So the guidelines is very clear in that. But how technology can help in this manner? So the first area is just simply increasing the basal rate by 10 up to 30 or 35% in the non-fasting hour post-iftar to cover the iftar meal. But we can use different things rather than the basal insulin. We can use, for example, the bolus wizard. Now, the patient will simply enter his blood glucose value as well as the carb that he's going to eat. And then the insulin pump using the bolus wizard will measure simply the active insulin time. So now you have an estimated bolus, and then this will prevent insulin stacking. And this is a very important criteria in insulin pump. Moreover, it's not just about calculating the active insulin time, but again, different types of boluses, which has been provided by insulin pump therapy. So you can range different type of boluses, either the normal one, a square wave bolus according to the extended period time determined, as well as the dual wave bolus. So we usually advise our patient to stop the post-iftar hyperglycemia or spikes. So they should consider a low glycemic index food. But again, another tip to be given is that they can do given a pre-iftar bolus by 15 to 20 minutes, provided that they don't have hypoglycemia. This has led to lower area under the curve 1 and 2 hours post-iftar. Actually, this is a common case scenario. The high glycemic index food, high fat and high protein. And look, the blood sugar went sky high, not only after 2 hours, but even after the 3rd and 4th hour. So we can see a delayed hyperglycemia post-iftar. And that's why, because of the macronutrients content, the impact of fat and protein, as well as the glycemic index. So when you're consuming too much fat and glycemic food, this will lead to high blood glucose starting not just after 2 hours, but ranging after 5 to 8 hours with hyperglycemia. Again, here comes the bolus wizard, and you can simply put the square or dual wave, and we can see in this case scenario that we has done the splitting of the bolus after initiating, just giving 40% before iftar, and then ranging 60% for the remaining bolus after 5 hours. And you can see even in the figure that it has flattened the curve without causing hyperglycemia post-iftar. So if we're looking at the food tips, looking at the timing of bolus, the type of bolus, as well as the insulin on board and active insulin. This is very important because those steps for healthy eating is crucial during fasting. So we ask them to cut off the high sugary beverages and to increase the intake as much as we can of the liquid food. So this is important. So you can simply adjust the postprandial blood glucose by keeping a low glycemic, healthy food and a low fat. And always remember that we can adjust the insulin to carb ratio as well as the insulin sensitivity factor. And always remember to individualize everything according to the patient needs. So let's move to another point, which is Taraweeh. This prayer is considered as a type of exercise, and we can simply set and edit a temporal basal rate. So by using a temporal basal rate, you can decrease by a certain percentage, whatever determined by the healthcare provider over a certain time, again to prevent hypoglycemia. Another option in the insulin pump that will help us. And let's add the CGM studies, looking beautifully in the effect of sensor. So now we are not seeing the roller coaster effect of the blood glucose between the fasting and non-fasting hours, but you can determine the rate, severity, as well as the frequency of both hypo and hyperglycemia. All the previous studies have been cited both in the DAR guidelines as well as the SPAD guidelines that has been led by the ASPER president, my dear friend, Dr. Esma Deep, for the first time looking into the adolescent guidelines, and you can read thoroughly about the usage of technology to conduct safe fasting. I don't want to forget fasting and COVID. And definitely the DAR global survey that has been conducted and showed that even COVID-19 did not affect the decision of fasting. Let me add the help of telemedicine. So just simply by downloading the insulin pump and CGM, you can access the patient data, do the virtual visits, just do the changes. And by then, even without going to the lab, having the HbA1c, you can have the glucose manager indicator giving you the average blood glucose control. Telemedicine is actually crucial in the COVID-19 era. Let me end with recent Ramadan studies that have shown the effectiveness and the best results in pump settings. So if you're looking at a recent publication about just using the basal insulin adjustment, and those were the control group, versus the intervention group, where they have used the option and pump, either the temporary basal or have used even the extended bolus features. And from their results, they have shown less hyperglycemia in those who have used more option in insulin pump versus those who have used only adjustment of basal rate. And another interesting case report coming from Italy about an Egyptian 20-year-old girl who were not able to fast in Ramadan during frequent hypoglycemia, but actually using the tandem T-Slim insulin pump with the predictive low glucose suspend algorithm had let her using this download, and how she was able to fast without hypoglycemia using the predictive low glucose suspend algorithm. Another beautiful publication for an adolescent 13-year-old male using the 670G hybrid closed loop. So even an adolescent were able to fast, and you can see time and range ranging 75%. Beautiful line download throughout the day, daytime, and nighttime. And let me show you some differences using the hybrid closed loop. So the basal adjustment is done automatically. So you don't have to do these changes, as I have mentioned in the earlier versions of the pump. And again, you can do increase in the meal bolus from 10 up to 20% if you're using more than 100 grams of carbohydrate. And again, you can do it the splitting, as I have mentioned before. You can use the 40-50 before and a 50-60 after, because the dual wave and square boluses are disabled in the hybrid closed loop. Another option is that you can use a temporary target for 2 to 4 hours if the glucose level reached 80 milligram per deciliter in order to avoid further glucose decrease. So now we can see even the hyper closed loop are giving better options. And you can see time and range reaching 78 in this trial, time above range 20%, and time below range 2%, beautiful illustrated glycemic control using the hybrid closed loop. So I'm concluding here that Ramadan fasting is feasible, provided that you have an educational program. This is the mainstay here, to have a safe and stable glycemic control. Yes, we can see that technology is a game changer, and pump usage will lead to decrease in hypoglycemia, both by the low glucose suspend, predictive glucose suspend, and even the newer version of closed loop. Also, you can use the bolus wizard, whether the timing, the dose, or the type of boluses, and you can see the flexibility provided. Don't forget that now you're having more time and range, more than 75% in the usage, decreasing the severe hypoglycemia, and the other side of the coin, both hyper, DKA, and even glucose variability is more sustained, and definitely improved flexibility and quality of life. So when you're looking into the better time and range, so now you're not just having the 75%, but look, some patient, even like Ibrahim, is having with the hybrid closed loop 100% time and range, which is perfectly done by the closed loop. Don't forget about the balance between education and technology to have the best glycemic control in those patients. And as viruses do not discriminate, and neither should we, and I mean here about the affordability, availability, as well as sustainability of those technologies are not even between developing and developed countries. And definitely this should be taken into consideration.